Femoral shaft. The appendicular skeleton is composed of the pectoral girdle, pelvic girdle, and bones of the extremities. Which of the following bones is most vulnerable to injury? Clavicle. The upper extremity joins the shoulder girdle at the glenohumeral joint. The carpals, especially the scaphoid, are most vulnerable to fracture when a person falls on an outstretched hand. The ischium, ilium, and pubis are fused together to form the acetabulum. Hip fractures are actually fractures of the femoral neck. The fibula is not a component of the knee joint. When a person jumps from a height and lands on his or her feet, direct trauma occurs to the calcaneus. Blank is a dense, fibrous membrane that is important for bone repair and maintenance. Periosteum. After 35 years of age, age-related decrease in bone density is accelerated in females because of decreased estrogen levels secondary to menopause. Osteoporosis is most accurately defined as a significant decrease in bone density. The joints that connect the ribs to the sternum are examples of cartilaginous joints. Diarthrosas are the most mobile joints of the body. A blank is a pad-like sac or cavity located within the connective tissue, usually in proximity to a joint. Bursa. What structure helps maintain the stability of a joint and determines the degree of joint motion? Ligament. By maintaining a state of partial contraction, blank muscle allows the body to maintain its posture. Skeletal. Skeletal muscles that are not used or exercised tend to atrophy. The energy for muscular contraction is derived from the metabolism of blank and results in the production of blank. Glucose, lactic acid. Skeletal muscle is innervated by somatic motor neurons. The upper extremity's blood supply originates from the subclavian artery. The anterior and posterior tibial arteries are direct subdivisions of the popliteal artery. A pathologic fracture occurs when an occult medical condition causes abnormal bone weakness. Which of the following is the best example of an indirect injury? Shoulder dislocation secondary to falling on an outstretched hand. Which of the following musculoskeletal injuries would most likely occur together? Knee dislocation and tibial fracture. What type of fracture occurs at an angle across the bone, and is typically caused by direct or twisting force? Oblique. A stress fracture would most likely occur when the muscle develops faster than the bone and places exaggerated stress on the bone. The most significant immediate risk associated with an open fracture is hemorrhage. In a closed femur fracture, blood loss may exceed blank before enough pressure develops to tamponate the bleeding. 1000 milliliters. The most reliable sign of a fracture is deformity. Which of the following statements regarding a non-displaced fracture is correct? Non-displaced fractures are generally caused by low-energy trauma, and are typically not associated with deformity. A patient standing with his or her head cocked toward a knockdown left shoulder most likely has a fracture of the left clavicle. Eliciting for crepitus during your exam of a deformed extremity may cause further injury to the bone and surrounding soft tissues. The best way to detect deformity or any other abnormality in an injured extremity is to manipulate the extremity to assess for false motion. A subluxation occurs when a joint is partially dislocated. A dislocation is considered an urgent injury because of its potential to cause neurovascular compromise. The sudden twisting of a joint beyond its normal range of motion, causing a temporary subluxation, is called a sprain. Immediate pain from the heel to the calf, and a sudden inability for plantar flexion of the foot is most indicative of Achilles tendon rupture. Signs of bursitis include all of the following: except deformity. In contrast to osteoarthritis, rheumatoid arthritis is a systemic inflammatory disease that affects joints and other body systems. When assessing a multi-systems trauma patient, it is most important to avoid being distracted by visually impressive injuries. Closed bilaterally fractured femurs can result in internal blood loss of up to 3000 milliliters. After ensuring your own safety, your next priority when caring for a patient with an extremity injury is to prevent further injury. Which of the following is not one of the 6 P's of musculoskeletal injury assessment? Passive extension. When assessing distal pulses in a patient with a lower extremity injury, it is most important to compare the strength of the pulses in both lower extremities. Which of the following medical conditions would most likely cause changes in sensation in a patient with an extremity injury? Diabetes. The goal of pre-hospital pain control in a patient with a musculoskeletal injury should be to Diminish the patient's pain to a tolerable level. Swelling and inflammation associated with musculoskeletal injuries are reduced. If cold packs are applied during the acute stage of the injury, correctly splinting an injured extremity helps to control internal bleeding by allowing clots to form where vessels are damaged. The first step in splinting a musculoskeletal injury involves exposing and assessing the injury site. The MOST practical method of splinting multiple fractures in a critically injured patient is to splint the axial skeleton using a long backboard. You should not apply a pneumatic splint on a patient if he or she has an open fracture in which bone ends are exposed. The likelihood of experiencing systemic complications from a musculoskeletal injury is related to all of the following factors, except the splinting method used in the field. Which of the following is not an intervention the paramedic can perform to help reduce the risk of long-term disability following a musculoskeletal injury? Pre-hospital fracture reduction. Compartment syndrome occurs when pressure in the fascial compartment leads to impaired circulation, sensory changes, and progressive muscle death. The return of myoglobin to the systemic circulation following a crush injury would result in all of the following conditions, except metabolic alkalosis. The risk of a pulmonary embolism following musculoskeletal trauma is highest in patients with pelvic and lower extremity injuries that lead to prolonged immobilization. Common signs and symptoms of an acute pulmonary embolism include all of the following, except pulmonary edema. You arrive at the scene of a motorcycle crash and find the rider lying supine approximately 20 feet from his bike. He is still wearing his helmet. As you approach him, you note that he has bilaterally deformed femurs. You should manually stabilize his head and assess his airway. Give enough isotonic crystalloid fluids to improve her mental status and radial pulse quality. Administering analgesia and then properly splinting her injury. Immobilize the knee and the ankle. A 19-year-old man experienced direct trauma to his left elbow. Your assessment reveals gross deformity and ecchymosis. His arm is pink and warm, and he has a strong radial pulse. Your transport time to the hospital will be delayed. You should splint the elbow in the position found and reassess distal circulation. Loosen the splint, elevate the leg, apply ice, and notify the hospital. IV therapy with a crystalloid fluid bolus and albuterol via nebulizer or mucosal atomizer device. Oxygenation and ventilation support and rapid transport. Supplemental oxygen, spinal motion restriction precautions, an IV line of normal saline, stabilization of his hip with pillows, fentanyl if needed, and transport.